Good afternoon, everybody, and welcome to the NCD Alliance webinar on the 11th of January 2017, and a very happy new year to everyone. My name is Dain. I'm the Executive Director of the NCD Alliance. So today we have a range of speakers and a range of issues to cover with you. So if we could go to the next slide to the agenda, and I will run through the agenda with you briefly. So we're going to start off with a very quick kind of overview of 2017. So what has this year got in store for NCDs in global health more broadly. We'll then go into the main agenda item for today, which is to kind of go through agenda item by agenda item of the WHO Executive Board, which is taking place in Geneva in a couple of weeks' time, and that will be presented by Alena Matzke from the NCD Alliance. Within that, we'll have two presentations on two specific NCD-related agenda items of the EB. We'll have Marc Wortmann from the Alzheimer's Disease International to present on the WHO Global Action Plan on Dementia. And we'll have Rosie from the Union for International Cancer Control to be presenting on the WHO Cancer Resolution that's being presented at the EB as well. Following that, we will have an update from Thompson at the Framework Convention Alliance on the recent WHO FCTC COP7, which took place in Delhi at the end of last year. And then finally, we'll have a presentation from Cristina Parsons Perez from the NCD Alliance on our recent European Regional NCD Civil Society meeting that took place in Brussels at the end of last year as well. So with no further ado, let's begin the main focus of the webinar. So firstly, just a quick overview of 2017 from my perspective. Firstly, next slide please, I just wanted to talk through very briefly the kind of headlines of the NCD Alliance's advocacy priorities for this year. We've got 5 main advocacy priorities, as you can see from this slide, and just to talk you through each of them very briefly now. Firstly, we're focusing on translating the inclusion of NCDs in Agenda 2030, i.e. the Sustainable Development Goals. We all know that obviously NCDs are included as a priority there, but it's going to take governments quite a long time before we're actually seeing this inclusion translate into action and resources and implementation. So we're focusing on a few different things in that regard this year. We're focusing on supporting the national and regional level response to the SDGs, obviously making sure that NCDs are prioritised. And then secondly, at the global level, the main milestone of the year within the SDG agenda is the UN High-Level Political Forum, which takes place every single year in July in New York. And this year it focuses on a number of the SDGs and it focuses on health, along with a few other goals. So obviously from an NCD community perspective, this is one of the big milestones and important events of the year, the UN High-Level Political Forum. Secondly, we're focusing on strengthening the links between NCDs and other areas of sustainable development, very much links to the whole mantra of the Sustainable Development Goals about being integrated and indivisible, and meaning that we should all kind of stop working in silos and link together and find common cause. And so the NCD Alliance over the last year or so has been focusing on 4 specific areas of sustainable development, where we are essentially trying to strengthen partnerships, elevate NCDs within these other areas, and essentially create win-win solutions. And we're focusing on HIV/AIDS, reproductive and maternal newborn child health, the environment, and nutrition. Thirdly, one of the long-term ambitions of the NCD Alliance in our new strategic plan is around financing for NCDs, and this is going to be a continuous advocacy priority for us going forward for the next 4 years. And within this, we're looking at improving the way that financing for NCDs is actually tracked, particularly development financing, as well as obviously trying to increase the actual quantity of financial resources, looking at both domestic resource mobilization through things like taxation, fiscal policies, as well as within bilateral and multilateral development agencies, so really trying to unlock financing for NCDs across the board. Fourthly, this year really marks the beginning of the NCD Alliance's focus on the UN High-Level Review on NCDs, which is taking place in 2018. So this is obviously going to be the 3rd UN high-level meeting that we have on NCDs. The first one, 2011, the second, 2014, and the 3rd will be 2018. And the preparatory process for the UN High-Level Review on NCDs really is starting this year. and it will mainly begin with the UN Secretary General's progress report on NCDs that will be published probably around October of 2017. But we're obviously beginning our preparatory processes now in terms of thinking through what we want to see from a process perspective for the high-level meeting, i.e. regional preparatory meetings in the lead-up to the high-level meeting, when we actually want the meeting to be held, what level of representation, and Alena will talk to you about that in a minute when we talk about our priorities for the Executive Board. And then also obviously be consulting with our network around what we want to see in terms of outcomes from the high-level meeting. And all of our work in terms of our preparations for the 2018 meeting will be really gearing up for our final priority on this slide, which is the Global NCD Alliance Forum, which, as we've communicated previously, is going to be taking place on the 9th to the 11th of December in Sharjah in the UAE. It will be the second global forum. And what the forum will be focusing on this time is very much bringing together the civil society movement to be mobilizing around specific priorities for 2018 and to be really getting the NCD Civil Society community ready for the 2018 high-level meeting. So we're very excited about that forum. And as was the past forum in 2015, the main focus is on obviously our growing network of national and regional NCD alliances. So that's just in headlines our kind of priorities for the year. If we could go to the next slide, please. In terms of just a quick overview of calendar of events, we've posted on our website our detailed calendar of events for the year, which you're welcome to download and have a look at. But a few highlighted events here is obviously the Executive Board coming up at the end of January. In March we'll have the usual Commission on the Status of Women in New York. Well, in April there'll be the ADI Conference of Alzheimer's Disease International in Japan. Following that in May will be the World Health Assembly, where a lot of the agenda items that will be discussed at the Executive Board will be going then to WHA in May. 10th to the 19th of July is the UN High-Level Political Forum, as I mentioned, important for the health community and the NCD community specifically. And then, as usual, from August through to October, we'll have the WHO Regional Committee meetings. September 12th to the 15th will be the UN General Assembly. Again, always an opportunity to be focusing on the Sustainable Development Goals and obviously NCDs now being a part of that agenda. October, we'll have the Union's World Conference on Lung Health in Mexico, followed by...
Hello? Katie? She's not here, so.
Hello everyone, we seem to have lost Katie, and hang on a second. Alright, so maybe while we're waiting for Katie to come back online, I'm hoping that everyone can hear me. Now, my name is Alena Matzke, and I'll be presenting on the WHO Executive Board. Jess, if you could perhaps guide me over to the slide on the Executive Board. Okay. I'm hoping everyone can hear me. I'm just going to start the presentation on. Hello? Okay, great. Thank you, Diana, for letting me know because. Okay, great. Okay, so I will be giving an overview of the agenda items discussed at the upcoming WHO Executive Board session. It will be the 140th session, and it will run from the 23rd of January to the 1st of February. Now, start us off by having a look at the agenda from an NCD perspective. Starting off with agenda item 4, which is the post of the Director General, a topic that we are all rather curious to follow. And then obviously of particular importance to us is agenda item 10, which is on non-communicable diseases. And under this agenda item, we'll find several agenda items that we will be following closely, including the preparations for the 2018 high-level meeting on NCDs, the Global Action Plan on the public health response to dementia, the public health dimension of the world drug problem, the report of the Commission on Ending Childhood Obesity, and also cancer prevention and control in the context of an integrated approach. We've also heard that there's a possibility of physical activity being added onto the agenda. This is a rumor at this point, but it's possible that on the first day of the Executive Board will discuss to place physical activity on the agenda. So we'll be watching out for that and report back to you what the EB or if the EB will discuss physical activity. At the bottom of the slide, I've included a link which you can use to find all of the Executive Board documents, and as always, the webinar slides will be posted on our website following the webinar. So for everyone who wants to access the slides of this webinar, don't worry, they'll be made available to you following the webinar. And moving on to the next slide is agenda item 8 on health systems. Under this agenda item, we'll be looking in particular at creation of resources for health, at addressing the global shortage of medicines and vaccines, and also promoting the health of migrants. And I'll just pause here very briefly to ask my fellow speakers to put themselves on mute so that everyone can hear better. Thank you very much. Then following on agenda item 11, promoting health throughout the life course, in particular agenda items 11.1, progress in the implementation of the 2030 agenda, 11.2 on the role of the health sector and the strategic approach to international chemicals management, and also agenda item 11.3 on the global strategy on women's, children's, and adolescents' health. Finally, of interest to us are agenda items 14 and 15, in particular 14.3 and 15.3, which is a report on progress in implementing the framework of engagement with non-state actors, including a document that lays out the principles for secondments from NGOs, philanthropic foundations, and academic institutions. We'll be moving on, walking us briefly through the agenda by day. I'm focusing here on the first week. The Executive Board actually continues through Saturday the 29th to Wednesday the 1st of February, but the first week is of particular importance to us. On Monday the 23rd of January, the board will open and discuss health emergencies and antimicrobial resistance, along with a couple of other items. On Tuesday and Wednesday, a lot of the focus will be placed on the DG election, the election of the Director General. The board will nominate 5 candidates, which it will interview and then vote 3 that will then make it to the World Health Assembly. On Thursday, the 26th, the board will focus on program and budget matters along with the health systems item, and then on Friday, finally, it'll be discussing NCDs as well as the agenda items under promoting health through the life course. At the bottom of the slide here is the preliminary timetable, which will then be updated as we progress throughout the Executive Board agenda. And one of the reasons why I'm focusing here on the first week is that we'll really only be following the FENSA agenda item on Monday, the 30th, and the rest will be more administrative matters. Moving on. So I'll start us off with a bit more detail on the WHO Director General election. You see here a list of 6 candidates running for Director General. And as I just said, the Executive Board will draw up a short list of 5 candidates. The board will then interview these candidates and then nominate 3 to go forward to the WHO in May, which is when member states will vote in a new DG who will take office on the 1st of July 2017. And if you want to read up on the election process, there's a link on this slide that you can check out after the webinar. All right, so I'll start us off with more detail on the report on the preparations for the 2018 UN high-level meeting on NCDs. The report starts with a brief update on progress on implementing the 4 time-bound national commitments which member states adopted at the 2014 review. And the Progress Monitor, the WHO Progress Monitor, tells us that in 2015, 138 member states, so a large majority, had shown very poor or no progress in implementing these national commitments. And the report says that there hasn't been much change since, which should be of concern to all of us, really. The main obstacles that have been identified in impeding national NCD responses are lack of policy expertise to integrate NCD measures into national development planning, unmet demands for technical assistance from multi and bilaterals, and shift in health financing to a greater focus on domestic resources, and then also insufficient legal expertise to implement fiscal measures. This includes, for example, taxation and also industry interference. The report describes or lays out a process of regional multi-sectoral member states consultations that are meant to follow the publication of the report of the UN Secretary General. So between the fall of 2017 and May 2018, the WHO member states, in collaboration with WHO regional offices, are invited to host regional member state consultations to determine regional priorities and to provide inputs both into the preparatory process for the 2018 UN high-level meeting and to the meeting itself. And the results of these consultations will then be reported to the World Health Assembly in 2018. The report on NCDs also includes updates on specific assignments, such as the update of Appendix 3 of the current WHO NCD Global Action Plan. As a reminder, the Appendix 3 of the Global Action Plan consists of a menu of cost-effective interventions under each of the 6 objectives of the Global Action Plan and are intended to guide prioritization of interventions at the national level. The Appendix 3, the updated Appendix 3, now includes 86 interventions, which is a lot more than the original 62. And then these interventions are really across objectives 3 and 4 on risk factors and diseases, with no substantial changes under objectives 1, 2, 5, and 6. In our opinion, there significant improvements have been made compared to the original documents, in particular in the area of unhealthy diets and physical activity, for example. As in the original Appendix 3, you will see that there's a select number of interventions that are considered to be most cost-effective and have been identified in bold based on economic analysis, and these are now a total of 16 as opposed to 14 interventions in the original Appendix 3. In the current Appendix 3, interventions are listed separately as analysis and analyzed with WHO choice and those without WHO choice. The appendix also includes a note of caution, so to say, that explains that interventions without WHO choice analysis can still be cost-effective, affordable, and feasible, and that the absence of WHO choice analysis may be due to capacity constraints and methodological issues, and not necessarily because an intervention is not cost-effective or affordable. The document also clarifies that the WHO choice analysis really just provides a global parameter to member states, and then underlines that in each instance, local analysis is necessary, using, for example, such tools as the WHO One Health tool to really adapt policy interventions to the local context. The updated Appendix 3 also contains a paragraph on the importance of non-financial considerations. So under each objective, you'll find a variety of non-financial considerations given the limitations of cost-effectiveness and analysis. And the other parameters that are mentioned are affordability, implementation capacity, feasibility, health equity, and overall effectiveness of an intervention. With regards to health equity, for example, the document states that population-based interventions such as fiscal and environmental interventions are most likely to decrease inequalities, while individual interventions, in particular around education and awareness campaigns, could widen inequalities. And thus a combination of both population-based and individual interventions is recommended. Appendix 3 is accompanied by a technical annex that provides more information on methodology, including on WHO choice, and the results of economic analyses are separated for low and lower middle income and upper middle and high income countries. It's currently being discussed whether the Secretariat will develop an interactive web tool that would enable member states to compare and rank information for their own needs. And overall, we welcome the updated Appendix 3, really recognizing and commending the Secretariat for the improvements made and also for the inclusive consultation process with civil society. Next slide. Just want to go very quickly over some of the changes made in Objectives 3 and 4. If you've been following the tobacco control interventions, you noticed that at some point mass media campaigns were dropped as a cost-effective intervention. In the current updated Appendix 3, which will go to the Executive Board, this intervention is added back in with WHO choice and maintained as a cost-effective intervention. Under alcohol, we see 6 new interventions without WHO choice, and really also commending here the Secretariat once again for disaggregating the section on unhealthy diet and physical inactivity. Under unhealthy diets, we applaud we applaud that the WHO Secretariat dropped a reference to voluntary reformulation and now only talks about reformulation without this addition of voluntary industry engagement. And we also applaud to see such interventions being added, such as taxes on sugary drinks. And here in particular, because this intervention is added as as a cost-effective intervention with analysis backed up through WHO choice methodology. On physical activity, also really wish to highlight the improvements made on in this area with interventions strengthened around school programs, for example. Previously, the intervention on school programs only talked about physical education infrastructure in schools, but didn't call for quality physical education for all children in schools. So I'm really pleased to see that being added here. Under Objective 4, new interventions were added across Objective 4, including on multidisciplinary treatment of early cancers, primary prevention for rheumatic fever and rheumatic heart disease, a basic palliative care package for cancer, and also treatment of acute ischemic stroke with intravenous thrombolytic therapy were added with WHO choice. Another assignment that the EB report discusses is the approach to register contributions from non-state actors. WHO held a consultation on the draft approach that is being presented to the EB in the fall of 2016, which we as NCD Alliance, for example, responded to. And the current draft, I would say, is slightly improved, consisting of a self-reporting tool for non-state actors and an internet platform on which non-state actors can upload their own reports for broad comparison and assessments. The current document clearly states that non-state actors should register only those contributions that are related to activities within their core area of business. And this is, for example, a point that we had emphasized in the consultation process, that really anything that should be registered as a commitment on this platform should pertain directly to activities within the core area of business of a particular non-state actors. And an intense aggregate reporting on the activities of non-state actors to the WHA based on quantifiable output indicators to measure the achievement of the 6 objectives of the WHO NCD Global Action Plan. While we think that the current approach is improved, we still have a lot of questions on the usefulness of this approach to register contributions from non-state actors. In particular, given the voluntary nature of reporting and the limited capacity of the global coordination mechanism to quality assess and track process, we question if the approach will really produce meaningful data on non-state actors, and very much encourage member states to hold in-depth discussion at the executive board and to provide detailed guidance on the further development of this approach. The report also contains the proposed work plan for the global coordination mechanism for the period 2018 to 2019. As previous work plans, it's organized around the 5 objectives in line with the 5 functions of, it's organized around 5 objectives in line with the 5 functions of the global coordination mechanisms, and contains activities such as the establishment of at least 1 working group. No topics mentioned here though. The possibility of hosting at least 1 multi-stakeholder dialogue in this period. The global coordination mechanism will continue to curate a resource library to promote multi-stakeholder action and continue the global communications campaign that was launched in 2016. And it will also continue to provide integrated country support in collaboration with other WHO technical units. The report also mentions the evaluations of the Global NCD Action Plan and the Global Coordination Mechanism. So between the end of 2016 to the middle of 2017, there will be a midpoint evaluation taking place that will assess progress on the implementation of the WHO Global NCD Action Plan. And between May 2017 and January 2018, a preliminary evaluation of the Global Coordination Mechanism will take place. And you may remember that the NCD Alliance vision for the Global Coordination Mechanism was significantly different from the current setup. The current Global Coordination Mechanism is an informal member state-led mechanism run without the guidance of a board and operated through an unfortunately under-resourced secretariat and operating within a rather limited mandate, scope, and resources. And many believe that the Global Coordination Mechanism's engagement of its participants, the international partners such as civil society, private sector, etc., to date has been weak and could be improved, and that perhaps the mobilization of multi-stakeholder collaboration to deliver on the Global NCD Action Plan has fallen short of expectations. So this evaluation later this year could be a very useful opportunity for all of us to encourage revisiting this question of whether the current setup of the Global Coordination Mechanism is fit for purpose, and if not, how the GCM mandate in terms of reference could be strengthened. So this is an interesting development to follow as well, and very much encourage everyone to positively support this. And moving on from here, the report on NCDs ends with a resolution that is being considered by the board, which would recommend the WHA to endorse the updated Appendix 3 to note the GCM work plan for the period of 2018 to 2019. It would urge member states to implement their international commitments and to support the preparations for the 2018 UN high-level meeting, and would also request the WHO Director General to submit a report on the preparation for the 2018 UN high-level meeting to the 71st WHA. I want to pause here now for a brief moment and talk a little bit about the NCD Alliance process priorities for the preparations for the 2018 UN high-level meeting on NCDs. There's several priorities. First of which is that we very much in line with the suggestions by the WHO Secretariat recommend that regional preparatory meetings will be held in all WHO regions to prepare governments early and to define regional priorities as input into the process and outcome negotiations. And these meetings, in our opinion, should include also multi-sectoral and multi-stakeholder segments to engage ministries outside of the health sector and also to engage other stakeholders such as civil society. Similar to what was done in 2011, we recommend that a UN Civil Society task force be convened, which would then serve as the official mechanism through which civil society can provide input into the preparations and outcome document negotiations. As a third recommendation, we propose that an interactive civil society hearing will be held to create a space for stakeholders to interact with member states and to offer input into the comprehensive review process. And learning from what happened in 2014, we very much recommend that the hearing should be held no later than 2 months prior to the UN high-level meeting, so that the input provided by civil society during this hearing can be taken on board in the negotiations of the outcome document for the 2018 high-level meeting. Fourthly, we call for participation of member states at the heads of state and government level. This wasn't the case in 2014 and a major weakness of the 2014 review. Furthermore, 2018 really marks the midway point to achieving the global 25 by 25 targets, and thus we believe that attention at the highest political level is crucial for the success of the high-level meeting. We propose that the UN high-level meeting be held in September 2018, just prior to the UN General Assembly, and last for a minimum of 2 days to allow sufficient time for discussions. Again, this is really based on lessons learned from 2014, where the review only took place for 1 day. Finally, important point, the high-level meeting should conclude with an action-oriented outcome document. While this document is not legally binding, an outcome document is really the strongest possible agreement within the UN and preferable to, for example, a chair statement or a declaration. And we'll make available these priorities to you very shortly. All right, so this concludes the NCD agenda item proper. I will briefly discuss the implementation plan for the recommendations of the WHO Commission on ending childhood obesity. The actual EB report hasn't been published, so I can only speak speculatively on this agenda item. It's the only nutrition-related agenda item on this year's WHO Executive Board, and it's a very important one. So you will know that earlier in 2016, the Commission made its recommendations, and consequently an implementation plan was drafted to be presented and adopted at this year's World Health Assembly. And the draft implementation plan, which we reviewed and commented on in detail, had a lot of strengths. We commended WHO for maintaining the integrity of the initial package of policy recommendations, and also commended WHO for the strong recognition of the role of civil society. There are a couple of weaknesses, such as lack of specificity. We called for more detailed guidance to support member states in the implementation of the recommendations. Very significant weakness was the lack of monitoring of a monitoring and accountability mechanism to check process. We all know that gets measured, gets done. So developing a monitoring accountability mechanism is key in our opinion. And then also a further weakness in our opinion was that there was rather weak guidance on how to protect policymaking from corporate influence and rather timid transitioning on the role of the food and beverage industry in childhood obesity as a driver of childhood obesity. So depending on how the report looks like, that hopefully will be published this Friday, we will maintain our previous recommendation to develop a framework for evaluating progress on the implementation of the plan with clear targets and indicators ahead of the World Health Assembly, and we'll keep you up to date on the developments on this agenda item. Moving on to health systems. I'll be talking very briefly on 3 agenda items under health systems. The first one is a report on human resources for health and the implementation of the recommendations of the UN High-Level Commission on Health, Employment, and Economic Growth, which was, and this commission was appointed in March 2016 by the UN Secretary General, and made recommendations on how to create 40 million new jobs in the health and social sectors, and to reduce the projected shortfall of 18 million health workers, primarily in low and middle income countries by 2030. The Commission's recommendations and immediate actions align very closely with WHO's priorities in support of universal health coverage, with specific links to integrated people-centered health services, meeting workforce requirements for preparedness and response to emergencies, demographic and epidemiological transitions, such as aging populations, and also the increasing importance of NCDs. Also to add, this is not elaborated on in the report because the report was published earlier, but there was a high-level ministerial meeting that took place from the 14th to the 15th of December, which agreed a 5-year action plan, which is essentially an intersectoral joint program of work across the International Labour Organization, the WHO, and the OECD in order to support member states in the implementation of the Commission's recommendations. And this new 5-year action plan will be available for public consultation until March 2017. The next two agenda items under health systems are addressing the global shortage of medicines and vaccines and promoting the health of migrants. The report on addressing the global shortage of medicines and vaccines came as a response to a resolution at the 69th World Health Assembly in 2016, which requested the WHO Director General to develop technical definitions of medicines and vaccines shortages and stockouts, and the report provides an overarching draft definition from both the supply and demand side perspectives to facilitate reporting of shortages at wholesale level and to prevent, for instance, hoarding behaviors and price increases. There is a guidance for member states on how to use these definitions that is going to be prepared in consultation with member states in 2017. The report itself doesn't mention the UN High-Level Panel of Access to Medicines report, but it remains to be seen whether the EB will pick up on this report and discuss it. On promoting the health of migrants, the report here describes the global context of migration and the associated health challenges, as well as WHO's response at global and regional levels, including regional partnerships with other UN agencies, and also outlines 10 priority actions, including the development of a global migration and health strategy, the promotion of a humanitarian development nexus by bridging short-term humanitarian assistance with long-term health system strengthening, and strengthening of inter-country, intersectoral, and interagency coordination and collaboration mechanisms. Moving on to promoting health through the life course, implementation of the 2030 Agenda. The report here describes how the 2030 Agenda is reshaping WHO's work at the country level, as a particular emphasis as to be expected on universal health coverage to promote health system strengthening, health equity, human rights, and sustainable financing. It calls for further research into the interlinkages between health and other SDGs to help create a new narrative of change. And it acknowledges the need to improve strategic planning, implementation, and reporting, particularly via the country cooperation strategies and UN development assistance frameworks, or UNDAS. Two more items that I will be covering under promoting health throughout the life course are the role of the health sector in international chemicals management. The EB will be presented with a roadmap for the health sector to achieve the use and production of chemicals in ways that minimize their very significant adverse effects on human health and the environment by 2020. And so the executive board is asked here to provide further guidance on the draft report, and we'll be following this agenda item closely as it relates to NCDs such as cancer, diabetes, and also heart disease. Then the Global Strategy on Women's, Children's, and Adolescents Health. Each year, the Secretariat will focus on a specific theme to support country-led plans. In 2017, the theme will be adolescent health. And the WHO is currently consulting on country-level guidance on implementing global action on adolescents' health in support of the global strategy. And this consultation, you may be involved in it, is going until it's open until this Sunday, the 15th of January. This year's EB is a particular focus on adolescent health, which obviously is a very important focus for the NCD community, as such behaviors as tobacco, alcohol, and drug use, poor diets, physical inactivity, etc., begin or are consolidated during adolescence. Coming closely to the end of my presentation, brief note on agenda items 14 and 15 on the framework of engagement with non-state actors. The report provides a brief overview of where WHO regional offices are in the implementation of FENSA. It states that the development of the WHO register of non-state actors is progressing and should be introduced before the WJ in May. There is a guide for staff and handbook for non-state actors on FENSA that are being prepared and expected to be finalized this month. And then finally, a document that you may want to have a look at here, EB 14047, which lays out the criteria and principles for secondments to WHO. And I just want to say here, these secondments exclude private sector secondments. So this is exclusively for civil society organizations and academic institutions, as well as philanthropic institutions. There will be a few executive board pre-meetings. In the interest of time, I will skip over the slide, and you can revisit the presentation slides following the webinar to learn more about these meetings. And sum up our advocacy priorities in a nutshell before handing over to my colleagues at the UICC and ADI to talk a little bit about the Dementia Action Plan and the cancer resolution that will be discussed at the Executive Board. So at this year's WHO Executive Board, we will support the endorsement of the revised Appendix 3 of the Global NCD Action Plan. We will call on member states to provide detailed guidance on the purpose, process of making commitments and monitoring and evaluation components of the proposed approach to register contributions from non-state actors. We will advocate for an ambitious implementation plan to end childhood obesity with a robust monitoring and accountability framework, to support the adoption of a global action plan on dementia and cancer resolution. We will continue to raise awareness of the interlinkages between NCDs and other health priorities such as RMNCAH, migrants' health, and the exposure to harmful chemicals. And we'll also very much raise awareness with member states for NCD Alliance's priorities for the 2018 UN high-level meeting preparatory process, which I have outlined early in the presentation. Just to say that right now we're focusing on the preparatory process for the UN high-level meeting, and later in the year towards the World Health Assembly, we'll be discussing much more the priorities for the actual outcomes of the 2018 high-level meeting. So what can you do? Please let us know if you're attending the EB, come meet us, update us on any relevant intelligence that you have, share your advocacy priorities and any planned statement that you will deliver at the Executive Board. And please take away our advocacy messages and share them with your government contacts and member state delegations on the ground. A comprehensive Executive Board briefing and our statements will be made available shortly on our website. And for all those that are unable to attend in person, please note that all sessions will be webcast. More information is included in the link on the slide. And please also look out for NCDA updates on the discussions and decisions post-Executive Board. So that's all from me, and I'll hand it back over to Katie.
Thanks, Alena, and thank you for picking up after I got cut off due to a power cut here. What I suggest is let's crack on to the next presentation on dementia and the cancer resolution, and then we'll take all Q&As from the EB together at the end there. So if I could pass over to Marc Wortmann, who's the CEO of Alzheimer's Disease International and is also representative on the NCD Alliance Steering Group, to talk us through the Global Dementia Action Plan. Marc.
Yeah, thank you, Katie. I hope you can hear me well. And thanks, Alena, for your really comprehensive overview of the whole week. So we're pleased at ADI that there is an agenda item now on dementia with a global action plan. And the first slide shows you why this is important. The numbers of people with dementia are still going up, and due to global aging, they will further go up unless we find a cure. And we estimate that at the moment now in 2017, we're close to 50 million people worldwide, and it will be over 130 million by the year 2050. Next slide, please. In this slide, you could see how these numbers are spread around the world. It's a bit unequal. Asia, with the highest population and the highest number of elderly people, has the largest numbers, and there's one new case in the world every 3 seconds. So there's really a need and an urgency. Next slide, please. Therefore, we're pleased with the draft Global Action Plan, and it has a vision of a world in which dementia is prevented and people with dementia and their carers live well and receive the care and support they need to fulfill their potential with dignity, respect, autonomy, and equality. Now, this vision is worked out in 7 areas of work, and that's in the next slide. First of all, dementia as a public health priority, and every area of work has a global target. In this case, it's 75% of countries will have developed national policy strategies or plans by the year 2025. Some people think it should be 100%, but I think it's a very ambitious target because we have only less than 30 countries now, so that's around 15% of the WHO member states. So many of them need to catch up in the next years. The second area is dementia awareness and dementia friendliness, so what can we do in the community? The third area is dementia risk reduction. Unfortunately, WHO is very much working in silos, and there's not much overlap or link with the general NCD work. And Johanna asked this question about how is this all linked together. Well, not very well. I think it should be a topic that Katie, you and I may want to discuss when we're in Geneva. The fourth area of work in the program is dementia diagnosis, treatment, and care. Also very important because although there is no cure, there's a lot that can be done for people who have the disease, but the diagnosis is crucial for that. And currently the diagnosis rates all over the world are very low. And this area has a target that it should increase to at least 50% of the estimated number of people with the disease by 2025. Then support for carers, both family carers, informal carers, and also professional carers is another area. And then the sixth is the information systems for dementia. And I will say a bit more about that later. And then research and innovation is the seventh area of work. Next slide, please. And as part of this information systems work, the WHO is starting what is called the Global Dementia Observatory, which is a function to monitor data systematically and collect them from member states, like we already have for many decades, for instance, in the cancer world. I think it's very important because without this you cannot monitor and you cannot keep track of the targets and indicators. It will start later this year with 3 pilot countries per WHO region. So in every region, if we have the 6 regions, there are 3 pilot countries, or even a few more, like in Europe. And this section of WHO will collect the public health data like prevalence, incidence, mortality on dementia, as well as information about current national plans. And we're pleased that ADI is involved as one of the stakeholders of this observatory. Now, the plan has been published as a zero draft last autumn, and they got a lot of feedback both from member states and civil society. Looking at that feedback, I think there is a big support from member states, so we hope that the plan will be adopted and will be put forward to the World Health Assembly in May. Thank you very much.
Thanks very much, Marc, for that. If you could just stay on the line, and then we'll come for Q&A after we've heard from Rosie. So our next speaker is Rosie Tasker from the Union for International Cancer Control, and she'll be talking about the WHO resolution on cancer control. Rosie, over to you.
Thanks so much, Katie. I will try and keep this relatively short and sweet. On the 29th of December, as a slightly late Christmas present to the cancer community, the zero draft of the cancer resolution was released. You can access it at the link here, or you can search for EB document 140/31. In general, we're really happy with it. There are certain elements which we're really happy to see. For example, it urges member states to follow through on cancer prevention and control commitments in the GAP. And given obviously that the GAP comes up in 2020, it also ties into the 2030 Agenda for Sustainable Development. We were really happy to see specific calls for accelerated implementation of the FCTC, specific mention of the human papilloma and the HBV virus and the need for vaccinations, but also drawing links through to screening for cervical, breast, colorectal cancers. And finally, the piece on improving the availability of essential cancer medicines and technologies. One of the key things for us was that it reiterated commitments to WHA resolutions which were existing and were cancer relevant. So those are the ones on palliative care, access to surgery and anesthesia, essential medicines, and patient-centered primary care, and that's in there at the moment. The resolution also requests WHO to develop a public health and policy-orientated world report on cancer in collaboration with other relevant stakeholders. For us, that's a key piece in tracking successful implementation. And we hope that other relevant stakeholders will mean that there's the capacity for civil society involvement. Next slide, please. That said, there are areas that we would like to see strengthened. In particular for us, and also in line with the NCD Alliance, we'd like to see stronger links with the maternal, child, adolescent health agenda, integrating with HIV services, and a greater focus on strengthening primary health care. The language is generally pretty great, but actually we'd really love to see strong language around scaling up access to diagnosis, treatment and care of cancer, and in particular identifying that there's the need for multimodal cancer treatment within that. We would like a greater focus on development funding and the mobilisation of new resources for health systems' response to cancer, really trying to move away from that idea that cancer is too expensive to treat. And lastly, a greater emphasis on the need for multi-sectoral partnerships to deliver the cancer component of the Global Action Plan and Sustainable Development Goal 3.4, which I'm sure we're all aware of. And really that idea that we need to bring everyone to the table to really ensure that this is an effective response to cancer control nationally. In terms of next steps, we're currently doing a briefing with our EB missions, which is co-hosted by UICC and the Permanent Mission of France. WHO are also present at that mission, and so we're hoping for a good, positive outcome, real expressions of interest from the missions around what's going to be happening next. As ever, we'd really welcome NCD Alliance support in awareness raising about the resolution at the national level. There are a couple of ways that we'd love people to get involved. For more contact, because I know we're fairly pressed for time, please do drop us a line to advocacy@uicc.org. Thank you very much.
Great, thanks Rosie for that, and thank you Alena, Marc and Rosie for those really comprehensive presentations about EB. We have some questions that have come in via both email and via the chat facility. Some of these are more directed to Alena, others I think Marc and Rosie, you'd be well placed to answer them. So the first question has come from, I'll read them all out and then we can kind of take them one by one. Paul Holmes from ACS. Alena, you mentioned in your presentation about the NCD paper at the Executive Board when talking about kind of progress on NCDs at the country level. One of the main obstacles for implementing national NCD responses was around industry interference. And so Paul's question is, can you say a little bit more about the industry interference as an obstacle to progress on NCDs? The second question comes from Louise Codling from the World Cancer Research Fund International, and it's about the preparatory process in the lead up to the 2018 UN high-level meeting on NCDs. And the question is, are the multi-sectoral member state consultations between October 2017 and May 2018, which are mentioned in the EB paper, are we expecting them to be inclusive of civil society input, or will that be a separate process? And then we have a couple of questions from Johanna Ralston. One of them is, considering that the EB this year, we've got a number of different NCD-related resolutions. We've got the cancer control resolution that Rosie just talked about. We've got the dementia, Alzheimer's discussions, and we've also obviously got the broader NCD resolution. How do all the resolutions envisioned for 2017 and 2018 align? So how do we all kind of bring it all together? And then secondly, in relation to the GCM, so Alena, you were talking about the evaluation of the GCM. Johanna is asking, what can the NCD community do in the near term to actually strengthen the GCM and to make sure that its role in the 2018 high-level meeting is meaningful and successful? So Alena, do you want to start us off, and then we'll go to Marc and Rosie for some responses?
Yes, thanks for these great questions. I'll start with the first one. So Paul, the paper itself doesn't elaborate on what it means when it says industry interference is an obstacle. But from my own personal perspective and everything I've learned about national responses on NCDs so far, I would say that this very much relates to, for example, interference of the tobacco industry, but also increasingly industries whose core business is increasing NCD risk, because these industries obviously have vested interests and are heavily lobbying their governments, for example, around the taxation of sugary drinks. We see very, very similar kind of lobbying and casting of doubt on the science around sugar, for example, that we've seen in tobacco control. So I think that's kind of where this is leading. So I think it's very much framed around risk factors. Then for Louise's question, so from our perspective, these regional preparatory meetings should include segments that would include civil society and non-state actors. In terms of, but it's going to be member states meetings. So the reports of these meetings will focus really on priorities that will be identified by member states for their region in consultations with all the other member states of that particular region under the umbrella of WHO. And so in terms of determining civil society priorities for the outcomes of the 2018 high-level meeting, that's kind of a bit of a separate process, but they should meet, and so there should be within those regional meetings, there should be space for consultation with civil society to influence the outcome reports of these meetings. And then similarly, for example, the civil society hearing at the UN that would include member states so that member states can listen to the input that will be provided by the civil society. I hope that's somewhat clarifying your question. And then finally, just responding to Johanna's question on the GCM, I think that the most useful strategy here really is it's for civil society to discuss with the GCM Secretariat and member states in a proactive manner how the GCM could be strengthened based on the recommendations that will come out of the evaluation that will be conducted later this year. So I think really taking a rather constructive position in helping the global coordination mechanism really deliver on its vision for increased multi-stakeholder engagement to achieve the objectives of the Global NCD Action Plan. So pause here and then and let Marc and Rosie respond to the other part of your question.
Okay, I should be unmuted now. This is Marc. Yeah, with regards to Johanna's question, I said a little bit in my presentation, but I think it would be good if we, from civil society, take an active role to align these things as much as possible. For instance, in the NCD plan now, there is no dementia indicator for risk reduction, although many of the measures will probably have an impact. And I don't know if the 2018 review would be an opportunity to add something like that. For instance, a 10% decreased prevalence compared to the projected increase through the impact of the NCD targets. I think that would be interesting to propose that.
Thanks, Marc. How about from your side, Rosie, in terms of making sure that the cancer resolution is supporting and aligning the broader NCD efforts?
Hi, Katie. Thanks for that. Yeah, Hannah, I think that's a really good question. We were really happy to see really clear language around needing to meet the cancer resolution and cancer control activities needing to support and work towards the 2030 agenda and obviously really clearly drawing out pieces from the Global Action Plan. So I think for us, seeing the Dementia Action Plan and seeing the cancer resolution are really exciting because it demonstrates the momentum that's building behind the NCD movement, but also kind of recognizing, we need to have these core set of prevention and treatment services in place for then each individual NCD to then be able to focus a little bit further on what it is that we need to do to tackle cancer or dementia in order to all come together and actually really achieve that 25 by 25 goal. Thanks, Katie.
Fantastic, thanks. I've just got a couple more questions. I'm conscious of time, but Marc, one for you. In terms of the Dementia Action Plan, I mean, obviously it's fantastic from our perspective that there is this new Global Dementia Action Plan. Are you expecting many kind of additional resources to come into WHO based on the action plan? Is it costed, for example?
No, it's not. So that's certainly one of the things we will ask for, whether there will be made provisions in the WHO budget. Because if that's not going to happen, then the implementation is in danger.
Yeah. Okay, great. Thanks. And just one final question for you, Rosie. We got via email from a Dr. Pakos from Benin. He says that in my country, in Benin, there's no radiotherapy available so far, despite the increasing number of cancer cases. So the question is, how can we leverage WHO decision-making about cancers and mainly the availability of radiotherapy in African countries?
Hi, Katie. That is that is the million-dollar question. No, so I think Dr. Parsons makes a really valid point, actually, that treatment capacities, particularly in many low and middle-income countries, are struggling to meet demand. Radiotherapy in particular, there are a lot of countries where radiotherapy either isn't available or is in incredibly high demand. There was actually if it's okay, I'll get back to Dr. Parsons with a couple of resources, but I think with regards to the resolution, actually, that there is language around there being clear treatment capacities is a really good hook for us NCD advocates to be able to go to our ministries of health and work with ministries of health, development agencies, and any other donors within countries to really say, we've seen fantastic advancement in NCD prevention, but actually treatment cure is an equally important element of this. So for us, hopefully, a strong document coming out of the EB and going into the WHA is a great opportunity to actually start having those conversations, and also for member states to be able to use the resolution to go to WHO, but also the IAEA, the International Atomic Energy Agency, and be able to ask for that specific technical assistance, but also for WHO to have the mandate to then deliver that. It's a pretty whirlwind answer, but hopefully that helps Bill.
Great. Thanks, Rosie, and thanks to Alena, Marc, and Rosie for those really comprehensive presentations on the EB. We'll now move on to our next agenda item, and before we do, let me just remind everyone that we'll be sending around the slides for this PowerPoint, and they'll be available on our website as always. And also, if you have any kind of follow-up questions from the webinar, please do email info@ncdalliance.org, and we'll obviously seek to respond to you as quickly as possible. So let's go to our next agenda item, which is going to be presented by Frances Thompson, who's the Executive Director of the Framework Convention Alliance and also is a representative on the NCD Alliance Steering Group. And Frances will be talking us through the recent COP in November in Delhi in terms of outcomes and FCA perspectives. Over to you, Frances.
Yes, thank you very much, Katie. And I realize we are a little bit pressed for time, but I did think that obviously looking at the list of participants, it varies from people who themselves went to the COP to other people who probably have not been following the FCTC process at all. So I want to give a bit of basics and some framing. So the basics is there's a thing called the FCTC, which of course is the WHO Framework Convention on Tobacco Control. It's quite old. It predates the NCD as a label, and so it's been in force since 2005, and at this point covers most of the world. The two big holdouts in terms of population at this point are the United States, which rarely ratifies anything, and Indonesia. And for the period from until 2014, the main focus of the Conference of the Parties, which is the body that meets every 2 years, was on writing guidelines. And guidelines are very detailed summaries of the best practice for implementing specific articles of the Convention. So there's a level of granularity in the process which we don't yet have on the NCD side. Next slide, please. But just comparing the two streams of discussion, if you like, on the tobacco control side, it started with negotiations on legally binding obligations. So a much more legalistic approach, very much focused on laws, regulations, policy measures. And only recently have people started to say, well, we started to say in particular, it's all very nice to have those obligations, but do we know if people are actually meeting them? And do we know what the obstacles are? And what implementation assistance is being provided? And is it systematic, etc.? If you compare that with the NCD process, obviously there's been much more high-level focus on the political will part. Yes, there's supposed to be national plans, but they're voluntary. And the policy decisions, I mean, if you look at the framing of Appendix 3 that we saw earlier, it's related in terms of options, not in terms of obligations. And they're fairly high level at this point, although of course there's increasingly more specific discussion. So in a sense, what we at the FCA have been trying to do over the last few years is mix a bit of the second approach into the FCTC COP. and get more of a focus on targets and outcomes and accountability. Moving on. Next slide, please. Yes. So the actual meeting was held in India, and it was indeed that cloudy. It was actually cloudier than that. It was actually even cloudy in the meeting rooms. This was, I think, the worst pollution that Delhi has had in several decades. And I think that was sort of symbolic of also the way that the COP went, which is to say there was a lot of pointless discussion about things where they clearly were never going to agree. And you had to look to see what was actually important. And I think a lot of governments didn't necessarily glom onto that quickly. This is the FCA delegation. Next slide, please. Before I get into more detail about what actually happened at the COP, let me just mention a little bit of the lead-up. As sort of long-established tradition, we had sort of extensive policy discussions on each of the agenda items ahead of the COP, so as soon as the official documents began to come out, and had policy briefs on 21 of the agenda items. These are developed by consensus on a listserv that anybody can join, various other kinds of information. The other thing we did do is this time, which is kind of formalizing the previous arrangement, is think a lot more about what it's like for new NGO delegates to come to these kind of multilateral meetings. So we had one-on-one mentorship and also a briefing day at the COP, which NCDA kind of helped with. And also, of course, lots of advocacy at the regional meetings ahead of the main COP meeting in India. Thank you. Next one. At the COP itself, as you saw in the picture, there were lots of us. There were about 200 civil society advocates who came. I mentioned the capacity building. There was an actual full day for the first-timers, and then another full day, which was the briefing day for all the civil society delegates, reminding people of our talking points, thinking about our strategy, and so on. And then, of course, the advocacy during the week, which is pretty intense. Mostly one-on-one advocacy, which we kind of coordinate via FCA meetings twice a day. Also, a daily bulletin is put out. It's also available on the web. It's published in paper to hand out to delegates, and various lunchtime seminars. Moving on. So how did we do? As I mentioned, we have been sort of focusing on the question of, now that we have all these obligations, what are we doing to see whether it's happening? And it is already the case that parties have to submit sort of detailed reports every 2 years about whether they're compliant with the various articles of the convention. The difficulty at present is that not much happens with those reports. So we had been pushing for quite a long time for a formal implementation review mechanism. So a committee mostly of parties to review these reports. Not what we got. What we got instead was something different, possibly better, which was a decision to essentially have a strategic framework for the whole convention, which has happened for a number of treaties and seems to be quite good, both at sort of focusing implementation assistance, but also at raising money. And so there will be a working group doing that over the next 2 years, presumably adopted then in 2018. Moving on. In terms of actually getting money, so there was an announcement from the UK of money for the FCTC, and we're particularly pleased because that came out of development funding, out of DFID money, which is the question of how are we linking up the discussions with respect to the SDGs, with NCDs, and with the FCTC. And we're hoping, of course, that will be the start, not the end, of development agencies making that kind of announcement. The other thing that was discussed in some detail, I think was likely to go ahead, is the idea that the FCTC Secretariat should have its own financing dialogue to mobilize resources for the FCTC, for implementation, which presumably would be similar to the system that WHO has in place. With respect to the 30% target, I'm sure you're aware there's the voluntary global targets right across the NCDs, but this tobacco-specific one has been adopted by the FCTC COP in its own right, and we've been pushing hard for that to actually mean something. So to at least know, do countries have national targets, and to know what they would have to do to meet them, and what they're actually, how far behind they are. We made some progress on that, but it did not get as much profile as we hoped for, and will obviously require more work in the future. Next slide, please. So what does that mean for FCA work in 2017? This is obviously a work in progress because we haven't had our first board meeting, and we will obviously have to consult members broadly. But clearly the strategic framework thing that's going to COP8 in 2018 is likely to be a big focus. So what do we actually want the Secretariat to focus on? What do we want in terms of measuring outcomes and so on? How do we make the COP process more focused? The other thing that's going to be a really real challenge is we're expecting sometime over the next 2 years that the protocol on tobacco smuggling will come into effect, and that will mean that they have to prepare the meeting of the parties to that protocol. And there's a whole bunch of fairly technical work that needs to be done that hasn't really been started. And we have to figure out as civil society how to engage in that, obviously mostly outside of our expertise as public health people. But we have to figure out how to influence that in a positive way. Next slide. So just a few very key dates. First, we will have an FCA webinar in early February, which will go over this in more detail. So you're invited to join if you want to hear more about it. And that will also provide more of an opportunity to talk about how members individually can get involved in the various things likely to happen in 2017. To mention also that the World No Tobacco Day, which is a thing that WHO has organized for, I think, 20 years, the theme this year is Tobacco, a Threat to Development, so an attempt to build on the SDG and also the Financing for Development mentions of the FCTC. And to mention also that the Latin American Conference on Tobacco Health is being held in June, and that will be with the President of Uruguay, who, as you may know, is personally very committed to tobacco control. Moving on. Just to mention that the decisions from the COP have now finally been published. They went up, in fact, at the beginning of this week. And for those who also want to know what the FCA said about the COP7 agenda, that's all still available, including the daily bulletins and so on. And of course, if you have further questions, feel free to contact me. I think that's it for now, unless there are questions.
Thanks very much, Francis, for that presentation. I've got a couple of just kind of follow-up questions. I guess, firstly, it's good to obviously see the COP, obviously having a broader focus in terms of aligning tobacco control work to the NCD agenda. And there's obviously quite a lot of linkages between the focus on obviously financing and accountability more broadly with the broader NCD community, which I think is really good. In terms of you were talking about the fact that there's no accountability mechanism established, but that there'll be this working group to develop a strategic framework. Are you expecting kind of civil society involvement in that one at all, or will it just be governments?
Yeah, so the mandate for that working group says 3 NGO representatives and 3 intergovernmental organizations. Now, it actually says up to 3 in both cases, so it comes down to negotiating with the Secretariat and with the Bureau. But I would expect, yes, indeed, civil society to be quite closely involved, and the drafting group at the COP that put this proposal together, we were also involved in that one. So I think that we will be involved, and it is a great opportunity to try to think a little bit more and formalize those linkages. Because I've obviously talked about it because that was what our priority was, but certainly a lot of parties went to the COP, I think, not thinking about these linkages at all. And I think quite a number of them left the COP without thinking about those linkages. So we still have quite a hill to climb in terms of making people understand why any of this should matter to them.
Mm-hmm. Yeah, sure. And then in terms of the focus on the 30% target, is it expected that there will be regular kind of reporting on the 30% target to the COP?
Well, that was already in the decision that was taken in 2014 that they have to report back each COP. But to be honest, the reporting wasn't. It wasn't clear enough about what needed to be reported, and accordingly, it's been treated as not that important to date. And I'm not sure that we have yet convinced the parties collectively that it's something they need to put more time into. But we certainly have a few champions, so certainly we need to talk about how that's going to fit in with the discussions back and forth on the NCD targets. But obviously, since in the case of the tobacco control specifically, there's only one target, and there's a whole week for the conference of the parties, it would make sense that would actually be kind of the framing for the entire week. How are we doing? And it wasn't this time around, but we're hopeful that we can make it that by next COP.
Great. Thanks very much, Francis, for joining, and really encourage everyone to have a look at those additional links that were included on that slide at the end in terms of COP7 decisions and FCA's resource page as well. Thank you. So let's move on to our last agenda item. We've just got a very brief update for everybody in terms of our European regional meeting that took place at the end of last year in Brussels. So let me pass over to Cristina Parsons Perez from the NCD Alliance to give this update.
Thank you, Katie. Right, so I'd like to update you on the European regional meeting that took place in Brussels on the 12th, 13th of December. The NCD Alliance has conducted a number of these regional civil society meetings. Last year we conducted one for the African region in collaboration with the WHO Regional Office for Africa. We have conducted a similar one in the Southeast Asia region and the Eastern Mediterranean region. So we worked together with the European Chronic Disease Alliance, and the meeting was co-sponsored by the WHO, and we were very pleased to count with the presence and support of the WHO's Regional Office for Europe. It was particularly key for us to hold this regional meeting at the end of last year, and this was following on the heels of the adoption of the 2016-2025 WHO European Action Plan on NCDs that had been adopted at the regional committee meeting in September last year. And so the meeting was really kind of framed around that European Action Plan, and really was about hearing and discussing how civil society can, what part they play in the NCD response, and how they could play a role in the implementation of this action plan for NCDs for the WHO European region. And the meeting was also important to us from an NCD community perspective, knowing that whilst there are some great examples there of civil society organizations active throughout Europe and the WHO European region, but we know that more can be done with regards to working together as networks and really actively sharing information across the different diseases and risk factors. Next slide, please. So as for other similar regional meetings, the aims were to really set the scene and kind of homogenize the knowledge of participants on the current state of affairs with regards to global policy, but really how civil society is contributing to that NCD response. It's also about strengthening the capacity of civil society organizations of the region to form networks and to be working together on the topic of NCDs. And as I said earlier, it really was about supporting that implementation of the 2016-2025 European Action Plan. Next slide, please. So the strength of these meetings, of course, lies in the participants, and we were glad that we counted with nearly 70 participants from 22 countries across Europe. It was particularly important to us that this meeting really really address the NCD response in the WHO European region. So we had several participants from EU countries, but we had many participants from non-EU countries and from CIS countries, which was particularly important in bringing that diversity to the table and really kind of understanding how different civil society is and how different the national situation on NCDs is as well in this region. So we were able to hear from the NCD response from the EU perspective. Also here we had participation from the WHO GCN, who were able to share with us the global NCD frameworks and also to count with numerous examples of civil society organizations in the region, and particularly from networks in existence in the region as to what they are doing. Next slide, please. So in order to inform the meeting, we conducted a survey of NCD civil society organizations in the WHO European region. This is now being supplemented with in-depth interviews with key leaders of civil society on NCDs, and we will be following up in the next few weeks with a finalized mapping of NCD civil society within the European region, and we'd be glad to present on those results once this document is out. And it's important to us that this mapping serves to inform civil society strengthening efforts in this region, and so will be available in both English and in Russian. The regional meeting came out with a series of recommendations to strengthen the action and contribution of civil society in this region. I'll go briefly through some of those now. And importantly, the meeting resulted in the active interest of certain participants in forming NCD alliances networks in their own countries, and this is something that we are tracking and following up on very closely. Next slide, please. So the methodology for these meetings is that as well as obviously kind of sharing good practice and experiences, it really is about networking and having participants discuss what they're doing in country with regards to different aspects. And at the end of the meeting, there is an active discussion, very active discussion on basically to come up with a group agreement on recommendations for the different groups that are involved and present at the meeting. So, and I think that these are really interesting in that they do provide a roadmap to follow and a little bit of a great snapshot, basically, as to where these different kind of groups of stakeholders are and what they can be doing towards the NCD response. So recommendations for civil society in the WHO European region spoke to basically accelerating national action through the different roles of civil society, and that of course includes advocacy, awareness, accountability and access, and this commitment for civil society to play an active role in the implementation of the WHO European Regional Action Plan. A lot was said about the need to reach out to non-health stakeholders, and so we see recommendations here and an agreement on the need to coordinate more and to work together to be forming these NCD networks at the national European level and to be reaching out to those non-health stakeholders and to seek opportunities in existing meetings at the region to bring different NCD advocates together to continue these planning, to kind of spark that coordinated planning for national action. And one thing that was really interesting to us, and we were really pleased with this, basically, was that we were able to count with the presence of several of the NCD alliances that exist and are active in this region. That includes the Norwegian NCD Alliance, the Danish NCD Alliance, the German NCD Alliance, of course ECDA, and so it was really, we were very pleased to see this emerge as a recommendation, this acknowledgement of the need for existing alliances to provide peer support and mentoring to nascent NCD alliances in the region. Next slide, please. So with regards to recommendations for the NCD Alliance, and again, I think this sets a nice kind of roadmap for us going forward here, that the NCD Alliance is obviously going to play a kind of an active role in supporting NCD networks in this region, and this it really kind of involves an acknowledgement of the need for producing guidance and resources in the Russian language. There was a lot of discussion around the need for supporting civil society efforts and accountability. So there's a role for the NCD Alliance to be playing there. Of course, the Global NCD Alliance Forum happening in December will offer a great opportunity for several of these advocates to be attending and to be, again, for their capacity building, but to encourage, it's just a great opportunity to have advocates continue their kind of planning on civil society action in this region, and of course involving people living with NCDs and the NCD response. Next, please. Now, we were very, as I said, it was great that we were working with the WHO Regional Office for Europe, and I think it's important to share the recommendations that emerged that were towards the regional office, and of course we're seeing a commitment and a recommendation there around consulting and actively collaborating with civil society, obviously according to FENSA in that implementation and evaluation of the 2016-2025 WHO European Action Plan. Also interest and interest from the WHO Regional Office to look for other opportunities at existing conferences and events where civil society can be convened. And I think this was there was one recommendation that emerged here that I think was particularly interesting to observe, which is this real recognition of from the WHO perspective of working with civil society to make sure that national reporting to the UN is really reflecting what is happening in country. And so I think this really speaks to that role of civil society as watchdogs, and making sure that our decision makers are aware that civil society is very active and mobilized and on NCDs and reporting on what is happening at the national level. Next and final slide, please. Okay, so things to look out for that will be coming from the NCD Alliance to our network, that mapping of NCD civil society in both English and Russian. We will be also translating our practical guide on building effective national and regional NCD alliances in Russian in a couple of months' time, but you should expect very, very soon a full meeting report where you will be able to see, if you're interested, who exactly attended the meeting. I would like to thank our federations and our different partners that were present and that recommended representatives from their networks in this particular region. So thank you very much. I'm not sure if we have any. I know we are very, very over time, Katie. So I'm not sure if we have any questions or.
Thanks, Cristina. I've got a couple of very quick questions, and thanks for everyone for sticking with us, even though we are a little bit over time. Just a couple of questions. So the European Regional Civil Society meeting is the 7th Regional Civil Society meeting we've supported or organised over the last couple of years. Even though obviously each region is completely different, I'm just wondering if you're seeing any kind of common themes emerging from these regional civil society meetings. And my second question is about how are these kind of regional civil society meetings linking into the Global NCD Alliance Forum that's taking place in December 2017?
Thank you for those questions, Katie. I like that first question a lot about the similar themes that we're seeing emerging. I think that every region has their own kind of idiosyncrasies with issues being faced, but I've certainly kind of concluded that civil society organizations are very similar across the different regions. So this I think a lot of it speaks to two things. One is about coalition building and the challenges therein, but also kind of this recognition of the added value is one of the things that comes across clearly here. And the other one regards advocacy. And I think that although every region is very unique, we really do see some common themes emerging here. So the role of civil society in accountability, for instance, and understanding how exactly should NCD Civil Society mobilize to do that is one thing. The other is this recognition that there are many different advocates within the NCD community that really have some great expertise that can be shared between this community. So for instance, when we're talking about accountability, really kind of we know that the tobacco advocates have been active in this space, for instance, so kind of acknowledging that. And then with just another theme with regards to advocacy is this relationship with governments, and how civil society should be relating and kind of keeping that relationship, kind of cultivating relationships with decision makers, and knowing how to position themselves advocacy-wise with putting pressure when they should. So building those relationships, but knowing how to also keep a safe distance and independence of others. And there are many other things, but I think those are, I just want to highlight those. The Global NCD Alliance Forum is a fantastic opportunity for us to convene NCD civil society globally, and I think what is one of the things that is going to be, that we want to be sure to do with this next forum happening 9th to the 11th of December is to make sure that we have time built in for advocates to meet, to be sitting down with advocates from their region, to be discussing what they are doing, and to allow for that kind of experience sharing and advocacy planning at the regional level.
Fantastic. Thanks, Cristina. So that brings us to the end of our webinar. Thank you again for sticking with us, even though we've gone over time a little bit. Thank you to all the speakers that have joined us today. Just a reminder that all of the PowerPoint slides will be available on our website, as always, and you'll be able to click onto the links to go to the relevant documents. And we'll be communicating with you shortly in terms of our next webinar, likely to be at the end of February, where we'll be able to report back on the outcomes of the Executive Board. Thank you for joining. Goodbye.